Hello and welcome to Healthy Veins, Healthy Legs, the only radio program that will give you a leg up on ways to identify and get help for ailments of the leg that can not only be cosmetically bothersome, but could actually be a big threat to your overall health and well-being. Now, here's your host, Mike Buck, and Hawaii's senior vein specialist and vascular surgeon, Dr. Robert Kistner.
Boy, we've been looking forward once again to this moment where we could join you and talk a little bit about your legs and your veins and your health. And it has become more and more obvious to me as a patient and a facilitator for the show that there are many of you that are responding to different things. And one of the biggest deals right now in the threat of changes in our health care and on our insurance and everything else is how much can I do myself? So that's what we're going to talk about a little bit today. Dr. Kistner wanted to say, you can really help your own cause by, first of all, identifying what's going on with you. And then secondly, taking responsibility on your treatment. Don't expect the pill to do it all. That would be nice, Doc, if we could just say, oh, yeah, we've seen you. Here's a couple pills. You'll be just fine. But there's more to it than that. We got to get proactive here.
Well, it's kind of a teamwork, Mike. The patient comes in with a set of problems, and often it's complex. But anyway, they come in with a set of problems, and then the doc does some diagnostics, and then he comes up with some ideas. But those ideas might not fit the patient's way of life.
Yeah, I was going to say, see, here's the thing, and we hear this a lot, and I've now that you've been, indoctrinated me with this word for the whole time we've been doing the show, I hear more and more in other medical areas where somebody presents, and it's when you present a new violin player that you get all excited to introduce this. But in your profession, when somebody presents, that means it's the initial observation. When somebody comes in and you say, wow, this is a prima facie example of this condition. I'm wondering if when you talk about that, it's, if say, for instance, if you're a clerk in a shoe store, yeah, you pride yourself on knowing what size foot somebody's got walking. That's an 8 wide. You go get them a sample. True in your profession too, even though a lot of what you do is seen after somebody at least partially disrobes or gets into a gown where they can be examined. Is it true, Doc, that sometimes you can just, when the minute somebody walks in, you should say, I need to help this person needs me?
Well, you can do it, but you'll be wrong half the time.
I'm setting you up for but you know what? There's been a fix in that, because I want to compare the Venous practitioner of yesterday and today in the diagnostics that are available, in some of the treatment procedures that are available. There used to be an awful lot of invasive stuff done. And like you said, maybe you didn't know what was going on in somebody's legs until you open one up.
No, I mean, you open up a very, very important aspect. And one of the things that the longer you take care of veins is you can't tell by looking.
Yeah.
And so... but you can tell by looking with ultrasound, because that shows the veins. So the fortunate thing is now, and opposed to previous to 1980, we can look with just the ultrasound, don't have to inject anything, and we can see the veins flowing inside, so we can tell the naked truth.
Yeah, and it's, and there you go. Now, see, here's the thing. I know that in this day and age, everybody wants to consider themselves technically enabled. Nobody uses a phone book anymore. I hate, if you work for the Yellow Pages, I'm sorry, but I haven't opened one for 3 years. It's Google this and Google that. And I'm wondering if some people will say, well, my leg is swollen. And it's Saturday morning and my doctor's on vacation or whatever. And so I'll just go online and I got a swollen leg. Here's what you got.
Well, they do. And, of course, that's the most important thing. So when the patient presents, your observation that that's an unusual way to address about what happens, but the patient does present at a certain point in their life experience, and they have a story. That story is called medical history, and that story is really extremely revealing to the physician, because it sets up what they might have genetically possibly inherited. It tells you something about whether their veins have bothered them before, and most importantly, how the veins are bothering them at that time.
I remember when I first became a patient that one of the first things that you asked of me, and then I filled out in different forms, is what sort of history of vein disease there is in your family.
Yeah.
And I learned at that point that a lot of this, unfortunately, we have to thank our tutus for because it's hereditary. So the more you know about your family history, the better prepared the doctor is going to be able to say, okay, well, that makes sense. Now here's we're going to treat that.
You know, it really plays a role, and it can play an important role, for instance, in clotting. If your family has had blood clotting, that can change the whole ball game and makes the physician alert to the possibility in your own leg.
I guess that almost everybody wants to say, well, look, you know, before I went to the hardware store and asked the guy for the widget, I tried to fix this myself. I tried to fix my screen, my door, my carpet, my whatever. And I'm thinking that there is, when you see all of the advertising, you know, let's go back a minute. I remember when advertising for medical profession first started. Remember, certainly when you first became a doctor, it would have been, was it unethical or just plain not acceptable that you never saw advertising?
I can't answer that. You certainly didn't have public education the way we do, an informed public, and now we do.
Yeah, that's what I'm getting at. And, you know, the information is only as good as the source.
Right.
So if you get it from a mainstream society, you know, a mainstream area like your network television show or whatever, probably somebody has at least vetted out some of that to make sure that you're not some sham artist on there, whether it be a magic pill or a potion or a doctor. But a lot of us go to the internet these days, and I'm getting a little bit worried that some people say, well, it's on the internet, so it's true. I mean, you can't put something not true on the internet.
Well, the thing about the internet is that it is not regulated, so you don't know what's behind that, so you can't take it for granted, but it is a point that you can use for cross-reference to see whether this opinion, that opinion, begin to get crossing opinions, and the truth lies somewhere in there.
Yeah. Okay, now, that means that if you out there listening this morning have gone out and scoped it out on the internet, sometimes, I guess, Doc, that sometimes there would be sites that you go to that say, you know, if you are like this, you better go see your doctor.
Well, I think one thing to tell our public is that the internet's a great source of information.
I love it. I use it every day, all day long.
As long as you don't believe every word you read. So, in veins, if you have varicose veins, for goodness sake, go to Google and whatever your browser is, and look up varicose veins. See what you can find, because there's a lot of people who have put some really good information down about how you diagnose and treat veins, and they have pictures and all kinds of things that are informative.
I'm very glad to know that sometimes, and I've seen this happen at the Kistner Vein Clinic, and certainly at other places, where somebody goes in and they're definitely afraid that they have something that's going to be life-threatening, and it is explained away as, no, this is cosmetic, and we can deal with the cosmetics of it, and we can also keep an eye on it. The thing that I think is very hard for a lot of people to accept about vein disease is that sometimes it takes decades before it becomes a critical problem, and yet they want to kick themselves decades later when they say, gee, if I'd have known about that when I was 30, I might have been able to get away from this.
Well, that's true, but, you know, I guess that's true with a lot of diseases. It's true with smoking, for instance. Look at that.
Sure.
I mean, you look what that does to you. So, and so where we're trying to get to somewhat with what we're doing with raising awareness is to tell people that it's a lifelong story about veins, and to pay attention to them, and when they begin to cause some kind of problem or symptoms, it's worthwhile checking out with your doctor, because the doctor can refer you to places where they can at least analyze and tell you where you fit on the spectrum of vein disease.
That being said, does it always progress? I mean, you know, once you've been diagnosed with vein disease, if it's, I don't know if it's small kind, if it gets bigger, or if it always progresses, or if you can maybe do something to arrest its development.
Yeah. Well, all of that, and it's a very good question, and we don't know all those answers because of studying the life history. So let's take 100 people who have a varicose vein.
Okay.
So what's going to happen to that 100? Well, we know that 1 out of that 100 will probably get an ulcer.
Okay, now the ulcer gang is not a sore stomach from having too much or not enough Pepto-Bismol. An ulcer is a sore that won't heal.
Okay, so that's a sore on the lower leg that won't heal, and it's a real problem, and it's a matter of probable disability later in life. And it may be decades later, but there is a chain that connects those. So the person who has the first varicose vein, which you can say is Well, you have a abnormal vein, and you may have progressive problem with that, or you may not. So the young person who has this vein, and it's usually on the leg somewhere above or below the knee, but in that general area, that's something to watch. That's all. It's just something to watch, like your first toothache, I guess, or whatever. And it may never come back again. It may never progress at all. And so many of them probably do not progress at all.
Okay, now you've explained on other programs, and we will be talking in a little later on in this program, folks, with some actual case studies. One way worse than the other in their part of the disease. But you talked about this before, and once you've got this observance going, where you've got this, it's not to say that everybody that has a couple of cosmetic blemishes on their legs, which are varicose veins, are going to be wearing big old wraps and having surgery someday.
That's right. Not at all.
Yep.
And so the first thing you might notice is a blemish. It's a little spider vein. Those are things right in the skin, and they're just kind of a blemish. They often don't translate into anything further. The first varicose vein, and that's a bubble under your skin, and a kind of bluish bubble. That's what I was talking about earlier. So that is an abnormal vein, and that is the process that may progress from just a little vein somewhere to a kind of a chain of veins, either in your calf or your thigh or both, kind of going up and down the leg. Then when you get into that group, then you very likely are in something where the chance to develop a vein ulcer later in life is more like 3 to 10%.
Okay, so now it's an increasing rather than decreasing chance. Now, I think there's another thing too, and I know that if you ignore a toothache, it's just going to get worse until you need a root canal or something done to it. So that's pretty much a broadcast from your body saying, hey, you know what? I'm not happy with the situation. I'm going to hurt. I'm going to swell. I'm going to cause tingling. I'm going to cause all this stuff. But what if you don't get any symptoms?
If you don't get any symptoms, fine.
Yeah, you don't have any heat. You don't have any cold. You don't have any itching. Okay. So it sounds to me like you don't have much to worry about.
Now, are you not having any symptoms? Are the veins getting any bigger?
Yeah, see, that would be a symptom, wouldn't it?
Well, not really. A symptom means that something abnormal, but you might see this thing and see a group of veins developing. So that's a sign of progression. And the stuff develops so slowly, so it's not a day, a week, a month. It's not even. It may be decades.
Is that sometimes, Doc, sort of a problem in the profession?
Sure.
Because you know what's going to happen to me down the road, but it just hasn't happened yet. So it's hard to get me motivated into doing anything if it's not a problem right now.
Well, look, I saw somebody just past week, and this person had a kind of a blood clot, but they had a deep, dark brown or almost black spot on the lower inner leg. And this thing, had a great big obese person. This thing is bound to be an ulcer in the near future. And now, is it this week or this month or next year? I don't know, but it's got to go.
All the signs are there.
It's there.
Yeah, all the signs are there.
So that person is really in a situation where, wow, you really want to take charge of it.
What's to prevent an ulcer from happening or something from happening once you know it's at that brink? Is there treatment that would be available prior to its outburst, prior to it opening up?
Well, that's what this person said. What do I do?
Yeah,
I don't want an ulcer.
Yeah,
no, of course you don't want an ulcer. Well, what are you willing to do for that? So the person said, well, what can I do? And so, that's a difficult question to answer because you have to know so much about the whole venous system plus the person's body habitus, which means how much are they big and how old are they and what's their background. So then you have to go into the whole deal in order to answer that simple question.
You know what I think? I think that while there's a symptom, there's a symptom. But I don't think that outside of people that have been paying attention to our program, that anybody really knows how this system works, what it is, what's the difference between an artery and a vein, what do I do if these things become swollen, if they become painful. It would just be like, I just don't know if you can pick up a magazine and say, hey, here's all you need to know about veins. Just not out there.
No, it's not out there.
Yeah.
And that's what we're really trying to do is to raise the bar so that people at least are aware that these things are there, they can progress, and there's a whole raft of things that can be done. So we didn't answer your question really.
No, but you did mention earlier that the veins will get bigger, and I'm wondering if you've got a vein that's doing its job and it's taking that blood from your lower extremities back up to your heart, going through your abdomen, all that, and it's just doing fine. It's got good valves, everything's fine with it. If it starts to get bigger, is that because it's symptomatic of something going wrong with it? The veins get bigger when they're damaged.
What's happened is that other veins, either adjacent to or even maybe a long way away from that vein, have also developed weak walls.
Okay, so that other vein's trying to take on the responsibility of some of its other veins.
No, no, it's an affliction.
Mm-hmm.
I didn't use the word disease, but they're the same. Okay, so it's something going wrong with the vein wall. Now, why? The first question is, well, why is that going on in my leg?
Sure, everybody.
Well, I don't know. We don't know the answer, but it does seem to follow in families, so there may be probably is some genetic susceptibility. It happens in about 1 out of 3 people. So there are 2 out of 3 people who don't have any of this. Okay.
What I am worried about, and one thing that I learned about my own self, folks, and this is, it just so coincidental that I happen to be doing some good things to correct health issues that I had. In addition to the good things that I was doing, I was decreasing a venous condition. I was decreasing a worse problem to the point where I got pretty proactive in my own treatment. And what I'm concerned about is that usually, because you say that this disease sometimes takes a long time to where it's symptomatic, to where you really need to get treatment, is that as we go along, we've got other problems. And maybe some of those are running parallel with the venous situation, that we're just, we're kind of a train wreck waiting to happen. We got to take a hold of a lot of things and fix a lot of areas, not just one.
Yeah, that's certainly true. And so anything else that goes wrong with the individual's whole body may affect the veins to some extent, or may not. Mm-hmm. They may be totally separate, but they do add to their burden of what's wrong. The veins, though, often they're just there, and so you go on with your normal life, you hardly feel them, and maybe you look at them and see them, or maybe your some child comes up and says, "Well, what's that?"
Yeah, Mom or Grandpa, what's that? What's
a
that
lot of people come in.
Yeah, no,
that's why they come in.
Sure.
Huh?
Yeah.
And so they're not willing to have that, and then it makes them self-conscious, and then they begin to dress and cover this thing up. So it has a big psychological aspect.
When my daughter was a young little child, when she was 9 or 10 years old, she asked me if I was shot. Did somebody shoot you in the leg?
Really?
Because I had a big round blue vein. Oh. I mean, that was there. It was there for years. By the way, this is another thing. Dr. Kistner, I've been a patient for a long time. And they tell you that, oh, yeah, you treat these things and they'll eventually go away. And a lot of people are not very patient. Like, I'm an instant gratification kind of dude. I want to see something shot and then disappear. I can't find where some of those things were anymore. And I had some of those for decades before I dealt with them.
Well, that's nice.
Yeah.
That's nice to hear. Now, have you developed any new ones?
No. So far. Well, I shouldn't say new ones. Yes, I have. I've developed a couple little issues. I'm one of these people, once I came to grips with my disease, got treated. Over a period of about a year and a half, I had several procedures done with Dr. Kistner that treated all my apparencies. But yes, I do go in on a regular basis to have a sonogram, or ultrasound, because I think that's very important, because I was, as a patient, I remember you finding things inside that weren't apparent on the outside through that diagnosis. So you think, well, it's just like you go to the dentist, you go to the eye doctor, you go to everybody that where you have a specialist. Well, you got a vein issue, you got to get your veins checked out all the time. So yeah, I have had additional problems, but not in the same place where you treated one.
Well, see, one of the things we don't know and trying to collect evidence for is the concept that if you have this progressive problem in your veins, if you treat that problem, do you set the clock back so that it doesn't progress anymore or progresses more slowly?
Mm-hmm. Everybody has to ask that question.
That's right. And so, but we don't have the good data. We can't say, yeah, if I treat that vein, you won't hear from it for 4 years or 20 years or 6 months or whatever. We can't say that, Mike. We know that you'll feel better. We do have data that says you'll feel better, and you'll feel better for a long time. And so, but we're in the process of cleaning that data up so that we can specifically say, well, for this problem, yeah, you'll feel better, or this problem, look out for recurrence. So really what I say to people is we can treat the problem that you have, but we can't tell you where your next problem may be or when.
Yeah, I think that what is heartening to know about that, and we're going to talk about these couple of examples here in a minute, is the fact that it may be that there have been such rapid changes in the treatment and the diagnoses of venous disease now that there's not enough historical data to pile up since all those things came along to say this happened because of this and this happened because of that. Whereas many other parts of the profession, of other medical specialties, it's like, say, for instance, rheumatism. There's been hundreds of years of data based on symptoms and based on studies. I don't know if venous disease was considered as much before because it didn't manifest in as many symptoms. I mean, there's a lot of people that have rheumatism, or arthritis. You can't open your hands. You go to the doctor, they open my hands up. But that doesn't happen sometimes with the veins until it's pretty far along.
Well, that's right. That's right. So that we don't know. But we can now, if you present with your extremities that maybe they got a sore, maybe they have varicose vein, or maybe they had an old blood clot, we can put you in somewhere in the continuum of no disease to minor disease to serious disease, and we can stage you that way. And we're beginning to get so we can predict progression.
Yeah, and therein lies the key. Now,
we have 3 phases.
Yeah, let's and by the way, I've learned this, and so I just assume that everybody knows this. 3 phases, and within those 3 phases, there's 6 departments or six areas. So it's pretty much, once you get a patient and do a diagnosis, you can put somebody where they belong on that chart.
So the 3 phases are cosmetic.
Yep.
So anybody can tell that.
Yep.
But no symptoms. The second phase is symptomatic.
Okay.
That means it hurts, you feel, it affects your life in some way, but it's not that serious. And the third phase is skin changes. That means your skin, not just your veins, but your skin begins to turn bad, turns brown, gets holes in it, gets swollen, so things like that. 3 phases.
Yep. Now, for those that don't understand, maybe really quickly, when it gets to number 3, the skin, because the skin and the veins aren't connected. They sort of are, really.
Yeah,
because
I understand.
The skin's on the outside, and it's protecting all my stuff from falling out. That's what the skin keeps me in there.
Yeah.
Now, but once it gets bad, it can't function like it did before. That's why, in many cases, like mine and others, folks, you hear us talk about compression stockings all the time, because what I'm doing is supplanting the ability of my skin to do the same thing.
So, okay, good point. So the patient said, well, I have a varicose vein. It doesn't bother me or hurt me, so what?
Yeah.
Okay, well, so what? Well, so what is, maybe you're right. Maybe it won't ever bother you, but maybe it will. And so what could happen? Well, it could convert from just a dilated vein that's there to one that's affecting the skin of your leg, which is turning color. And once it turns color, it'll never go back to its normal color. That is, it turns a brownish or dark brownish color. You often see it in older people or people that have had injuries, and so they have brownish discoloration on the skin, and usually the lower extremities. Well, once that happens, it does what you said. The tissue changes, so it cannot go back to normal.
Yeah, and I think, excuse the expression because you're a doctor, it's a hard pill to swallow for a lot of us. In other words, I don't think anyone wants to be told anymore that we're not going to be able to make that go away. That's just something that you've earned with age or experience or something, or you're suffering. But however, we can still give you a good quality of life if you're willing to be proactive in your treatment, which is what we started saying this morning.
Well, you're really right. So when so as a professional, when you look at a person's leg and they have some brownish discoloration, you can say to them, well, we don't know a way to make that go back to your normal color, but it can get better with certain treatments, perhaps. It can get better. And then the patient thinks, well, I don't like that.
Yeah.
But that's a different thing than saying that the skin itself has turned to scar tissue, which is a later stage. Once you get to that point, then the tissues have changed, and you may get to a point where you have these holes in your leg that keep recurring because with the slightest little scratch, the tissue just is not strong anymore.
The skin's just no longer resilient or strong enough to deal with it. You know, I see this a lot in the dental field. Right now, there's been a big aggressive campaign on television, particularly saying by leading dentists standing up and saying, you know, you only get one set of enamel, and if you damage it, that's it. In other words, it's not restorative. If you damage your enamel around your teeth, boom. So you got to use this, you got to use that. Sometimes food that you think is good to eat, taking the enamel off your teeth, so you got to be able to deal with it. People stand up and they be counted when they hear something like that. They go rushing down to their dentist and say, "Wait a minute! I've been eating oranges all my life. What am I going to do? How can you treat me?" This is once again, it's education, and they learn more about it and they want to go deal with it.
That's true. Now, one thought occurs is that you can get false teeth, but you can't get false veins.
Yeah, no kidding.
And so, and it's not just the veins. You can't get false skin. You can get a coverage, but you can't get that wonderful thing that we call it. You know, skin's the biggest organ in the body, but it also has a tremendous amount of physiology going on and powers to heal and powers to stay intact for. No matter what you submit your skin to, it'll last for 100 or 120 years. That's pretty good.
Yep. Okay. Now, I'd like, if we can, turn it a little bit into some, for examples. We've got two people here to talk about a little bit today that sort of fall into some of the categories that we've been talking about. One, it seems, is maybe not too different from the way I was. In other words, conditions other than just varicose veins. Here's a lady, seriously overweight, that comes in with that had a blood clot some time ago, and maybe dodged a bullet and didn't get any other, but got driven to come to your office. Tell us a little bit about this person, what you observed or how she presented, and what the recommended path for either recovery or treatment is.
So she's I was kind of talking about that
earlier,
and so, well, for her, I mean, the simplest answer is. You have to lose 100 pounds.
Yep.
I mean, it's a total change in the way you live. You have to wear support, heavy support on that leg in order to try to get the tissues that are there to heal. You may have to have some veins removed from your leg, or you may not. You're lucky if there's something there to fix it. Will make it better. And in her case, this one person's case, it wasn't fixable because the veins inside had been destroyed and the ones on the surface were functioning pretty well. So there's not much we can do except to give compression and to lose weight. So, but there are some occult things, difficult things to find. So special testing may be needed even all the way up into the pelvis and into the abdomen in order to find out if there's something correctable.
Can it be that every now and again that somebody has either an epiphany about how bad they've let their health deteriorate, or when somebody has, as a treating physician or specialist, say, look, this is what you have, and these are some of the reasons why you probably have it, and this is the road you're willing that you should be willing to walk down to deal with it. How much of this are you going to bite off? Because what you said about this lady already is that she has lots of issues. In other words, the reality check is to turn that around, you got to start doing a whole bunch of stuff different right away.
Right. So if the doctor's in a conundrum there, and it's a matter of judgment of how to approach that person, because what the doctor knows is if the person doesn't follow certain advice and say lose the 100 pounds or and doesn't submit to or doesn't comply by putting on the compression and doing things they don't want to do, they never had to do in the past. If they're not there yet, you can't be successful with treatment. They're going to have a downhill course till they get to the epiphany point.
Yeah, till they get to that big moment. Now, this lady had actually had a blood clot that she needed to get fixed a decade earlier. when you went through the discovery process with her, was she as large a decade ago as she is today? Had she already been obese?
No. Well, she's larger now.
Yeah. Which is the path that most of us take. I mean, most of us don't get better from a condition unless you turn things around. Whether you mentioned earlier smoking, there's drinking, there's a lot of other abusive things we do that we don't really taper off unless something happens as a shocker to make us change.
Well, this happened to be a very vital person. She works all night long. She does a heavy job, does heavy lifting. She's a goer. And so she said, I don't have time to be sick. I mean, I can't take a day out to do such and so. And in my mind, I'm thinking, wow, you're not you're not seeing the big picture, because it's not a day; it's your career that could be affected by progression of your problem to the point where you got holes in your leg. And I can see that hole ready to pop.
Yeah.
So
see, that's what I was getting at. The diagnostics of today. And especially if you see somebody whose skin is already on the downhill slide sort of thing, well, gee, if something happens here, it's certainly not going to heal. Not the way it's supposed to heal.
But going around to her side, she's sitting there thinking, what's this guy telling me? I can't eat. I have to lose 100. I have to change my whole life just because of this silly thing down on the lower part of my leg. It doesn't even hurt that much yet. It just bothers me. So I didn't come here to hear that. Now, so you tell me, Micah, you've been in this situation. What should the doctor say?
Well, I kind of think that in this day and age, we want to be let up and let down sort of gently. But there's to a point where every now and again it's worth having to shock somebody. A friend of mine, the worst thing he could have done, well, first of all, he was a salesman for a liquor company. So it was his job to go out and get restaurants and stores and stuff to buy this stuff. So what do you do when you're a salesman? You take people out and have a drink. Well, this guy had been taking people out and have a drink for 30 years. Uh-huh. And then when he got home, he didn't mind the taste of it, so he had a couple more. Mm-hmm. So he was what they call, I guess, a functioning alcoholic.
Sure.
And until he came to grips with that, and it was through, I don't know, he saw some reality intervention TV program where somebody said, hey, you're an alcoholic. No, I'm not. That's what I do for, well, do you drink every day? Yeah. Do you drink so much every day? Yeah. Guess what? By definition, you're an alcoholic. Can you do without it? Nope. All right. So that was the epiphany this guy had. But he hadn't what they call with a regular alcoholic hit bottom, where somebody is without a job, but with their family leaves them and everything else. I'm not sure venous conditions all by themselves would get people to have that epiphany. I think that they need to be like this lady you're talking about, or like I was. My obesity is what gave me the jolt. And then the benefit of that was starting to feel better and then get other things treated that had been ignored. And so, and that's why getting up and down off the floor for a grandpa is as important as climbing Mount Kilimanjaro for a young guy in his 20s.
Well, everything you say hits home. Let me tell you from the physician's point of view. Yeah,
how difficult is that? That's a good. You asked me a question. Let me ask you a question. How difficult is, with all the experience that you've had in all these decades, when you look at somebody doggone well has pretty much abused themselves? They pretty much whooped the old dog too many times, and they are in trouble.
Okay, well, let me tell you the other side. So you're coming in and you're telling me this. So you're somebody and has this exact problem. So we have an interchange, mm-hmm. and you go out, and then you come back a month later, and it's no better, it's a little worse, and then 6 months later. So the doc is sitting there saying, I'm not getting anywhere, and it's not a very good use of my time.
Mm.
This is not no expertise. I mean, I've told this guy 5 times the situation. I had all kinds of opportunity to see the light, but they're just not ready. He's not there.
Yeah.
So why don't you go off and do what you do, and when you want to play ball, come back? Well, it's pretty hard to say that to the patient.
Yeah. Even though that's how you feel, the reality is, look, why would I waste my time for 30 minutes with this guy when I can spend 30 minutes with somebody that wants to be proactive, that I can be able to pick up her grandkid and walk back and forth to the store and not feel exhausted? I think that's a very important point.
Well, now, if you think that's true now, you just wait a little while until there are fewer doctors and a lot more patients, and nobody's going to spend the time.
Well, it's already been said that, the best health care that you can have is your own. And I think that now there are places that have vegan restaurants. There are places that that tell you how many calories are in something you eat, and if you don't pick up the ball and run with that some of that stuff, I got to laugh because Dr. Kistner and I have a mutual friend who's a cardiologist, and he said something to me a long time ago. He says, "It's really nice to see you here at the party instead of on a gurney." Not that I'd ever been on one, but, that is the difference. I mean, when you walk into somebody, it must be very hard, Dr. Kistner, because over the years you've got, thousands and thousands of friends who, many of which have become patients, that when you see somebody that's got to a point where they need emergency treatment, that's pretty, that's a real wake-up call.
Just before I came in here, Mike, I had the experience of seeing a guy that was literally seemed to be bleeding out with no way to save him in my office at one time. And this guy has gone through some rough times, but now he's up, a lot of scars on him, emotional and otherwise. He's 100 pounds lighter, and he's running around. He's got his heart fixed, and he's a new man a couple of years later. So that's incredible.
But let me ask you this, because I see this, and I'm sure that you do way more than I. Let's say that that I've helped somebody along with something, and you see them going about their business later, and you observe them. Wow, that. In other words, maybe you've a patient that at one time needed a walker to come into your place and get treated. That you see him shopping somewhere. You don't have to go talk to him or anything. You just see him walking around and you say, you know what? That's kind of why I go to work sometimes.
Well, that is.
Yeah, it is.
Yeah. I mean, but we're all in that. You do that in your field.
Well, yeah. I mean, if I'm on my regular radio program and I can get somebody an answer for a question, and then a year later have them walk up to me at a grocery store and say, I'm the guy that you talked to. I don't know the guy, but he says this and that, and it changed my life. That is like worth a lot of early mornings and late nights and frustration. But true, I think. And I'll bet you that there are friends of yours that are listening that are also patients of yours that are in that category where it's just very difficult sometimes to tell somebody, you lead this horse to water and you're the horse. I've been drinking you up to this trough for a long time. You better start drinking some of this, and you better do it soon.
Yeah, so that's the problem. So that goes back to this person we're talking about. And so there really does come a point where I think you're using the alcoholic, and there are a lot of people who say you got to let them go till they bottom out.
Right. That's kind of almost the philosophy of treatment. And I think that's too bad, because what happens if you can get there a year before the bottom? Wouldn't that be a better return? But I think that the individual has got to say, what am I lying here on the street for? Where are my shoes? What have I done to myself?
So the cure begins up above the brain, somewhere around the brain, right? Mm-hmm. So it's got to be central. And how do you get the person to that point? And that's the dilemma that the physician is facing. We're trying to talk to that. What is a physician who has some foreknowledge of what can happen and might happen to you as an individual, saying, how do I handle the situation today to avoid to change the result tomorrow?
Well, you mentioned that the lady that we've just been talking about needs to lose 50 to 100 pounds right away. And I would imagine what drove her to treatment or to be examined was that she probably had some sort of a threat at work where she thought, if I'm not able to do this, I'm not able to do what I want to do. I better go find out what the heck's wrong with me besides being 50 or 100 pounds overweight. Maybe it's something else.
Yeah, and so they have various options. So they may come and say, well, I'll check with you and see what you say, and then I'll go see whoever else. And so they can do that, and they might find something good. Sometimes you do. You really, in taking care of your own health, you don't know where it leads.
No clue.
So when you're dealing with something and you're not getting anywhere, it often makes sense to let's go get another opinion.
Well, how about this? Let's go to the next example we're going to use today, because this person is different. It's another lady in sort of the same age category, but otherwise pretty healthy, but a long history of veins. And I would imagine that there would be a different way to treatment her. Let me ask about this next person. What brought her into treatment?
She has an incredible story. She'll come on the program sometime.
That's wonderful. We love that
impressive.
when we do that, by the way, gang. We do it a lot.
This lady had varicose veins for many, many years. Didn't bother her. She's a hardworking lady, really hardworking, fine person and a family person, all that. And then she had something happen over a year ago. And she said, it must be a bug bite.
Ah, the old bug bite.
Bug bite. And so she did whatever she did, and it didn't get better. And then she went to see her doctor, and he did, or she did whatever they did, and which was a salve. Or
all kinds of bandage. I know where this is going. Lots of creams, different bandages, different treatment. And,
how'd you know that?
I because I was there. But I was there. I didn't. Mine wasn't a bug bite. If you remember, I had a trauma, and it just so happened that the trauma happened right over a spot on the landscape where I had a bad vein, and the two of them met in the middle. It was like the perfect storm,
Right.
and the thing wouldn't heal. Period, for a long time.
Okay.
Yeah.
Well, yeah, that's a similar story. So this person had it, and the equivalent thing to what you had was whatever that. Maybe it was a bug bite, or maybe it was not a bug bite. I don't know, but whatever it was, it got inflammation going, and the inflammation plus the vein problem are a bad mixture. They lead downhill.
But you said, here's the thing I find very interesting, folks, and maybe you can learn something from this. What was perceived by the patient as a bug bite, in all probability, wasn't a bug bite. It was something that they didn't remember hitting, they didn't remember dinging, and here is a hole.
That's right.
And so,
it could have generated from the inside out.
Yeah. And talk about the difference in treatment for something that develops from the inside and finally breaks through the skin like a volcano, or something that drills a little hole in you that you can fix with a salve or a Band-Aid.
Well, so this lady, going back into it, and what she said when I first saw her, she said, when this first came on, I had these big veins in my leg, and suddenly, she said, the veins flattened out. I don't know what she means by that. And then I got this sore, and it grew. And so when I went to the doctor, I said, there's something wrong with my veins. She diagnosed it, and she was right.
Yeah.
And the doctor, whatever they did, treated the inflammation, but not the veins. And so it never got better. And it got worse and worse. So this went on not for a day, a week, or month. It went on for a full year.
Wow.
Several physicians, various specialties and so forth. And she's at one point she saw a surgeon, and the surgeon took a good look at it. And then finally the surgeon said, well, you're not responding. You need to get some diagnostic tests done. And so she did, and found out that she had a venous problem. And then when she found out about it, here she is. She's now previously a healthy person, converted in the last year to somebody that really has to take care of this sore that won't heal on her leg, and pain and swelling and all that. When she found out about it, she said, "Well, I knew what this problem was the whole time. It's been my vein down in the leg, and nobody's taking care of that thing." What it turned out was that she just had a leaky valve from the top of her groin, all the way to this, directly to the sore. The vein went right down like a hose, and when she'd stand up, the pressure would pass from her groin straight down to this hole in her leg, and it couldn't possibly heal.
I need to ask a question, because as many times as we've talked about this, and folks, I think this is incredible, because I had this gaping thing. It was awful. I'm glad you couldn't see it, because it was terrible. But it didn't bleed. It didn't. A lot of fluid didn't come out of it. It was always there. And I'm wondering.
You mean the varicose vein or what?
No, I mean the ulcer.
The ulcer.
Yeah, the ulcer was just a hole that wouldn't heal. It wasn't. I mean, some stuff would come out.
Gotcha.
But it wasn't like a hose.
Okay. So that's under the ulcer. Okay.
Yeah, but then you have these other conditions where you'll be walking down the street, and all of a sudden, or in the shower, and all of a sudden a vein will let loose, and it will bleed. And this isn't an ulcer yet, right? It's just a hole. But what's the difference?
So what's the difference?
Yeah, what's the difference between this? I got a hole. It's called an ulcer. How come it's not bleeding all the time?
That's a good question. But, the difference is that the tissue around the sore becomes inflamed and swollen and all that. That won't necessarily bleed. It might ooze something.
Yeah, that's what I think it did. It would sort of always be, I want to say, almost damp all the time, even when it was bandaged.
Yeah, and it might even sweat or something.
Yeah.
The other thing where the hemorrhage happened is that a vein got up near the surface, and the vein wall was a very thin wall, and the outer layer of that wall ruptured.
Mm-hmm.
So then the vein itself was presenting as this thing, this conduit where there's liquid blood, and then came shooting out.
Yeah.
When the person stood up. So one was a hole in the vein, the other is a hole in the tissue.
See, one would think, though, I mean, if you just use, if you're a layperson like me and you're using analytical thought, that this must be an artery. It must be coming from my heart and coming out through a hole and pumping out onto the street.
That's the frightening thing.
Yeah.
Absolutely.
Yeah.
It scares people to death.
So I mean, that's why, and we've often had this said. Look, don't rump in an ambulance, go to emergency room, put the leg up, and it's going to stop.
Lie down, put your leg up.
Just be a little bit patient. But that being said, there is a big difference. I mean, I would imagine when a vein lets loose, that it doesn't have the same amount of certain pressure, but it's got some. Will it stop? Obviously, the spontaneous bleeding will stop sooner or later, but I would imagine if you stay in the same condition that caused it, it's not going to stop.
So maybe this will help. If it's an artery that gets a hole in it,
mm-hmm.
there's a pump up above called the heart, and it's constantly pumping straight down into that artery.
Right.
If a vein gets a hole in it, there's no pump underneath it except what's happening is that gravity is causing the inner circulation to back up and go out that hole.
Mm-hmm.
So you just lie down and elevate the part, and you remove the pump in the vein side, so you don't have any force.
So obviously this should be first line of defense.
Yeah.
Yeah, immediately something happens, boom.
Be.
Yeah.
So if the first thing, if you fainted and lay down, well, then nothing would happen.
Some of you that have heard the program before, and we told an anecdote, a long time ago, about a guy who was on vacation walking down the street in Waikiki and started just bleeding like a sieve. I mean, leaking, and then laid down, and somebody thought he'd been shot, called the cops because he had a hole in his leg that was bleeding. And he'd get up and try to stagger to go do something about it, get worse. Finally he goes down, and the thing does what it's going to do. It stops bleeding.
And it's not that rare. So some people have it. But so this lady, for 1 year had this problem. It was really affecting her life in a serious way, and psychologically, she told me that when that thing would hurt, she'd get a pain in her heart, and she was sure that she was going to die.
Yeah, see, this is so. Everybody's heard, the elbow's connected to the knee bone and all of that stuff.
That's what she said.
Yeah, and it just
connected.
It does make sense for somebody to think that.
And she said, well, so then the question was, well, do you still get the pain in your heart now that this thing is healed? And she said, no, it's gone. And there's no.
And you're trying to think, okay,
no
what are we going to tell this lady? Because there's no connection here. But I think that
But there is a connection. It goes through the brain.
Of course.
Yeah.
And there's another thing too, and that's probably why they have blind studies and they have placebos and things.
That's right.
Because if you really believe something's going to work, it'll work a little bit because you've psyched your way into it. But none of these conditions, it seemed to me, you can't think them away. You can think them away, but you're not going to think them away. In other words, if you ignore them, this is not good. This is what we try to tell people every week on the program. Don't ignore something that manifests or presents itself.
Yeah, that's right. Another difference between this second patient and the first one is a healthy person but had a blood clot, and then 8 or 10 years ago, and that blood clot left scars inside the vein, so the deep veins function abnormally. But everything else is normal in that person. So this is a history with a defined beginning and defined point now of maybe 8 years.
Now, just out of curiosity, because I didn't ask you this, was this lady a patient of yours a decade ago when she had the blood clot?
Yeah, I know that.
Okay, so, however, and I know you don't just, get on your speed dial and start calling everybody saying, I haven't seen you for a while. But those that are on regular treatment programs like me take it upon themselves to be proactive and say, hey, you know what? I haven't seen Dr. Kistner for a year. I better go take a look.
But she does. She has come back.
Mm-hmm.
But the point I wanted to make was this one has an 8-year history leading up to ulceration. almost pre-ulceration. The other patient had a 30-year history at least of varicose veins. And so how much slower the development is in the varicose veins than in the blood clot?
You know what I think, though, is that without saying it, one might think, well, what about all the other ways this person treated themselves, whether they were active, whether they were, a smoker or a drinker or an overeater or a diabetic or an obese person. All of those, I guess,
they do.
co-programs that you don't have, they all weigh in.
They do.
And so I guess even though the vein disease is a one that manifests and develops over a long period of time, I'm thinking that some people, once they come and get treated, realize, maybe there's a couple other areas in my life that I better look at and do a little work on.
Yeah, there's a lot of that.
Yeah.
In the vein system, you can have a problem, you can have it treated. Maybe it's a superficial problem, you can get it treated and it's fine. That can come back on you. And so the veins can rediscover that.
We look at some of this as being very visual. And I know that you've had patients before that come and say, I'm here because I remember when my mom was my age and her legs started to get really big and her veins started popping out. And I'm seeing a little bit of that right now. What can I do? What can I do to not be like mom was? Is there a short answer for that or not?
No.
Yeah.
But there is an answer. I think the beginning of the answer is awareness. Mm-hmm. Of the problem, and so checking up on it and finding out what you can do is, first of all, find out what's wrong with the veins, and so we can do that with minimally non-invasive testing and affordable. Find out what's wrong with the veins, and then be given signs, be aware of the signs of progression, and if you begin to see progression, then you check back and recheck them. Mm-hmm. So one diagnosis that the veins are okay doesn't mean
they're going to be okay forever. Okay, now, I know this comes up a lot. Somebody said, please ask Dr. Kistner the next time you can remember this. You talk a lot about ultrasound. What about x-rays? Are there some times when you will actually use good old-fashioned x-rays, or can you see veins in x-rays, or do they help?
Yeah, so now just a plain x-ray, you don't see the veins.
Mm-hmm.
So you have to put
the stuff that they used to put in stuff, right?
Yeah, so we used to call it a dye or a contrast agent, but it's something that shows up. It has an iodine base, and so it shows up on X-ray, and then it makes that particular vein that you injected into, it becomes visible. Mm-hmm. It doesn't show the rest of the veins.
Of course, yeah.
Well, ultrasound does. I mean, you can see other veins as long as they're functioning at the time that you're looking at.
Okay, now when you look at an ultrasound, because I've had this treatment a lot of times, gang, and sometimes you can actually observe it yourself because the screen's right there. Certain angles you can see, that's my vein in there. It does isolate the specific vein that needs treatment. I mean, you can see specific that one vein.
Yeah, not only you can see it, but you can actually treat it because you can put focus the ultrasound to see just one spot at a certain depth, for an inch or two under the skin. But when you get too deep, it's very difficult to position it. But
I remember one time, Doc, a long time ago, having an injection in my foot, and it was to have, was it barium? Is it that they call it? Is that
well, barium is something you put in the GI tract.
Oh no, this was an injection.
Yeah,
and to watch a vein, and it was Nixon's disease that they thought I might have. This phlebitis turned out to be okay, but that was one of the things that indicated it. Is that something that comes out on ultrasound as well quickly? Can you see that right away?
No, we don't use that same contrast. That contrast is just for X-ray.
Gotcha.
So with ultrasound, you don't need a contrast because the moving blood is actually the contrast, and it cuts the ultrasound. And so by that image is done by like a sonar bounces off this thing.
There you go. And that's a great way for us to end the program today. I want to thank you all for being with us and ask you to come back next time. We're here to educate you on everything you need to know about healthy veins, healthy legs. That's why we call it Healthy Veins, Healthy Legs. And if you'd like to know a little bit more about what's going on outside of your ability to jump on the internet, I'd go visit Dr. Kistner's website, KistnerVeinClinic.com. For everybody at KistnerVeinClinic.com, Dr. Kistner and me, Mike Buck, thanks very much for listening. listening. We'll see you again next time. In the meantime, get out and do some stuff. Get some exercise, eat right, and make sure that you realize how important those legs are, and particularly those veins that have all that blood going through them. And that's why you want to come back to listen to the show. Healthy Veins, Healthy Legs.
Thanks for listening to our program today. And for more valuable Healthy Veins, Healthy Legs information, visit us online at www.KistnerVeinClinic.com.